Thanks, everyone. Thank you for coming back. So on with the next session. We now have Nicole IKNL, who will be talking on the use of Fitbits in longitudinal cohorts of cancer survivors in the Netherlands. So Nicole is a senior researcher at the Netherlands Comprehensive Cancer Center at Tilburg University. She works dedicated to the Profiles Registry Study Group to improve care for cancer survivors. Has a specific interest in health promotion after cancer, the organisation of follow-up care and gynecological cancers. And you're also principal investigator of several studies, including the ENDURE trial, which is looking at the effect of a reduced follow-up scheme for patients with early-stage endometrial cancer. A FOCUS study, which is a cross-sectional study on follow-up after cervical cancer based on a personal fellowship of the Dutch Cancer Society, and the DICE study, which is a prospective cohort study on the stress after cervical cancer among patients with cervical cancer and their partners. And the VULVA study, a qualitative study to develop a core outcome set for patients with vulva cancer. All right. Thank you, Nicole. Over to you.
Thank you for your introduction. Yes, so I'm going to tell you today about our work with the Profiles Registry, and I will focus today on 3 studies that we are currently ongoing: the WATCH, the DICE, and the VITA study. So Profiles already started in 2004, and our aim is to assess the impact of cancer and the cancer treatment on quality of life, and to understand what patients need regarding care and supportive care after their cancer. And we started with doing cross-sectional studies where we sampled from the Netherlands Cancer Registry. So we have a population-based study design. And well, I'd say the last 10 years, we do a lot of prospective studies as well in a diverse set of cancer survivor patients. So we used a lot of questionnaires in the past, assessing different patient-reported outcomes on psychosocial issues, on lifestyle, quality of care. And we can then combine this PRO data and the cancer registry data, which is really nice because we have good quality clinical data combined with the pro data of patients, and we also have survival data. And we were able, because we knew we were inviting, because of the population-based sample frame, we could compare with the non-respondents with the respondents. So this was very nice studies. And we ultimately could combine all these data that we have collected for years and years, and published this in a report a couple of years ago, where we showed that cancer survivors survive all kinds of cancer types had many challenges and consequences of the cancer and the treatment, which were more severe and more prevalent than in the general population. And in light blue, you see the cancer survivors, and the dark blue are the general population. And you see all kinds of consequences like fatigue, what we know is severe in cancer survivors, but also difference in sexuality, depressive feelings, daily functioning, a lot of consequences patients face. So then we were asking ourselves, so a lot of patients face these consequences, but not all of them. And some recover and others do not. So why are patients react differently on the treatment, and why and how can we maybe in the future foresee who is going to have the burden of certain consequences and maybe earlier intervene for these patients. So that's why we set up the WATCH, the DICE, and the VITA study. We did it with a grant from the NWHO, and we set up these 3 cohort studies in thyroid, cervical, and hematological cancer survivors. So this is kind of the theoretical background based on the Wilson and Clary model, where on the right you see the quality of life of patients, and this is not only on itself, but it's related to other health aspects of the patients. So how do patients perceive their health? the functional health status, like physical activity and dietary patterns that they have, symptoms they experience, and also underlying biological functioning like inflammation and cortisol and telomere length. And then you have a lot of individual factors that also relate to all their health outcomes, socio-demographic, but also specific tumor characteristics, so the stage of disease or the specific treatment that patients received. And comorbidity is always very important in people's health. And you also have environmental factors that impact on the patient's health, like the partner, having a partner, or the healthcare system. So we wanted to assess all these specific health outcomes in patients and try to measure these outcomes on several ways. So we started with what we always did, our patient-reported outcome measures in a questionnaire, and used that to ask patients about all their consequences they experience. But we added a lot of new and novel measures to these questionnaires. So we used an online food diary, the AIDS meter, which was developed by the Dutch organization, het Voedingscentrum, which supports the general population in the Netherlands to increase their healthy diet in general. And we were able to have this online diary attached to the profiles registry. We also used Fitbit Inspire HR measures, smartwatches to assess physical activity, sedentary behavior, and sleep. And this is why I'm standing here, because we used the Hive and their database to collect these data from the cloud of the Fitbit. Patients wear these devices for 2 weeks. Around the same time, they also complete the questionnaires. We also use bioimpedance weighting scales to assess their weight, the fat and muscle mass. And patients also use these for 2 weeks. We sent all the patients with the questionnaire a measurement tape so they can measure the circumference of their waist, their hips, and their calf muscle. We asked patients to provide blood to assess the inflammation, kynurenine pathways, the telomere length, and we collected blood and saved in the biobank of Maastricht, which we had a collaboration with. We asked patients to provide us a hair sample, so to cut their hair on the back of their head. It's half a centimeter of hair, and you can use that to measure the cortisol in the hair, each centimeter hair is 1 month of growth hair. So you can do that for 3 pieces of hair. So you can go 3 months back in measuring their stress levels in the hair. So if we have the baseline measure, we can also measure their stress levels pre-diagnosis, actually. And in addition, we developed the Bijkanker app. This is an app to assess side effects during treatment. So patients complete this app. They complete the questions on side effects during their chemotherapy treatment. So we have a lot of different measures. Not all measures were equally in the same way implemented in all 3 studies, but we implemented some of them in only a few studies. And we had different time measurements. We started before treatment at 6 months, 12 months, and 24 months. And so regarding the Fitbit part, patients were invited before treatment in the hospital, and they were sent the Fitbits to their house, and in addition to the database that was already there, they developed a tool that we can have only to send an email to the patients to be able to connect their Fitbit and their account to the study number that they have. So that's what we did. We sent the Fitbit, we sent the email, and by clicking the link in the email, they were able to participate in our study, which was really, really nice. So at each next time point, they were completing the questionnaire, which they received at home, and they were also asked to wear then the Fitbit for 2 weeks. So we included at this time about 300 patients in the studies, and we're still the studies are still ongoing, so we're still including. We have some other big cohort studies in the Netherlands that also use the profiles registry, and these are just some examples of those. And actually, we are noticing that much of these cohorts or studies within these cohorts are now interested in also doing additional measures or using Fitbits, or maybe using the smartwatches that people have from their own, not only the ones in the study, but maybe we can also use the data from all the watches that people already have, which might be a nice opportunity in a kind of more natural way to use the data that's there. So we are thinking about that. So this is really a nice new development what we see in the field as well. So the data that we obtained from the Fitbit is the sleep data. We obtain the sleep duration, the WASO, the week after sleep onset, so how many times do people wake up during the night, and what duration is this wake up. And then you can calculate the sleep efficiency. We measure activity, the steps per day, but also the time spent in fairly physical activity or very high physical activity levels. We assess sedentary behaviors and also the physiology, the resting heart rate. And we are still kind of looking if we want to assess other things with the heart rate outcome of the Fitbit. It's kind of a new topic for us, what we need to explore a bit further. So currently we are planning our first studies, first analysis with physical activity data and relate that to quality of life. And we plan to do more of such analysis where we have the objectively measured outcomes and relate that to patient-reported outcomes on symptoms and quality of life. We also plan to do a validation study where we validate the Fitbit with the Actigraph. We do that in a breast cancer sample with 50 patients, and we're starting that soon. And we are setting up some new prospective studies in different cancer types where we want to implement at least the Fitbits, but some other measures as well. So we have ideas, sufficient ideas. Yeah. Well, I would like to thank the whole project group of profiles and you as an audience.